It's one of the great paradoxes of modern living. Every year we learn more and more about health and nutrition, but as a whole, we are far less healthy. Researchers have figured out how to use stem cells to create artificial organs, but we can't stop the increase in the number one killer, cardiovascular disease. 1 in 3 Americans has diabetes, largely due to the dramatic increase in obesity. Part of the paradox is that this declining health comes at a time when environmental and day-to-day stress has risen dramatically. More than ever, we need maximum health and vitality. In the 1960s, a young veterinarian with an agricultural background began focusing on the role of minerals in human health. Dr. Joel Wallach noticed that livestock producers paid special attention to feeding their animals correctly. The logic was pretty simple. Sick animals don't grow and reproduce efficiently. In other words, sick and distressed animals don't pay. Dr. Wallach became fascinated with an obvious question. Why don't we treat ourselves as well as we treat our animals? As he continued in his career, he was able to observe the effects of nutritional deficiency diseases in many different arenas. He began working as a veterinary pathology assistant, conducting up to 25 animal autopsies daily. He investigated the mineral intake of the world's longest living cultures. He traveled to Africa to treat and save exotic animals and endangered species. In 1966, he was invited by Marlin Perkins of Mutual Omaha's Wild Kingdom fame to participate in a landmark National Institutes of Health study on ecology, environment, pollution, and plant and animal health. Over time, Dr. Wallach conducted thousands of autopsies on both animals and humans and was published in 70 peer-reviewed medical and scientific journals. In 1982, he continued his formal education and became a naturopathic doctor, running his own clinic for 12 years. All of this practical experience and research helped him understand that nutrient deficiencies, especially mineral deficiencies, are at the root of many of our health challenges. And his drive and passion to provide answers for his patients prompted him to develop a list, a very important list. It contained all the nutrients, including minerals, essential fatty acids, vitamins, and amino acids that everyone needs on a daily basis. To live as long as possible, he said, with the highest quality of life, you must get these 90 essential nutrients every day. Of course, in today's world, getting those nutrients is very difficult, if not impossible, for 2 main reasons. Number 1. Our on-the-go lifestyle means that we are eating fast foods and convenience foods with less than optimum nutritional value. And number 2, even when we have the time and energy to prepare the right kinds of foods, their nutrient levels are lacking due to modern farming practices. Dr. Wallach knew he had information that would help millions of people to better health, but